You've agreed to watch your little niece for the day, so you take her to the playground. As she swings across the monkey bars, she begins to wheeze and gasp for breath. You're scared. You know she has allergies and asthma, but you've never witnessed an attack. What should you do? I'd like to take this time to tell you a little bit about asthma and what should you do in these types of situations. Asthma is a long-term lung disease that inflames and narrows the airways. Symptoms of asthma include chest pain or tightness in the chest region, rapid breathing, coughing, nasal flaring, shortness of breath, retractions, and turning purple in the mouth and nail beds. According to a study done by the CDC in 2011, 1 in 12 million people in the U.S., which is about 25 million, have asthma, and the number is increasing every year. This year, 75% of students in an elementary school in Valdosta suffered with asthma. There is no cure for asthma and no way to prevent being diagnosed, but there are preventative measures taken for asthma. Long-term and quick relief medication are given to asthma patients according to the situation. A child's personal triggers can help in preventing an attack. For instance, if a child has an asthma attack commonly due to exercise, the medication would be needed to be given to the child prior to the exercise to help prevent it. My brother, when he was younger, used a nebulizer to control his asthma, but now takes pills. Medication can be given via nebulizer, inhaler, and pills. Medications for asthma include Advair, Qvair, Vinyl Adderall, and albuterol. The CDC reported that about 12 million people in the U.S. had an asthma attack in 2008. If you think someone is having an asthma attack, you must be able to recognize the signs. At first glance, look for difficulty breathing and at the color of the skin of the mouth and nail beds. If the skin is not pink but blue, it is a common sign of lack of oxygen. Also, check the mental state of the child, which can be altered from lack of oxygen. Secondly, listen to the lungs for air movement and check the heart and respiratory rate if a stethoscope is available. Check oxygen saturation if an oximeter is available for oxygen in the blood. If the oxygen is too low, the child must be put on oxygen immediately. When a child has an asthma attack, it is very important to stay calm and to try to get the child to be calm. Recognizing the symptoms, eliminating the child's triggers, performing treatment with quick relief medication, which is probably going to be their inhaler, and or calling 911 in severe cases are critical to the child's health. In conclusion, asthma affects many people in the U.S. The airway tightening disease can be controlled through medication. It is important to recognize signs, symptoms, and triggers of an asthma attack. Thank you.